Okay, so I want to show you some different ways in which you can kind of modify your activity if you have chronic pain or acute low back pain or any back pain with certain movements that we can try to avoid to try to help you get better. So the first one we're going to go over is just getting into and out of a chair. So a couple different things you can think about. What we really want to try to do here is move more through our hips and less through our low back. So we're thinking about kind of the hips here, hinging forward, getting our head forward, but only moving through here, not leaning over in the back like that, okay? You could also put your hands on your thighs here and kind of just push down a little bit as you come up. This actually causes you to engage a little bit of your core, so it stabilizes a little bit, so that when you come up, it's more of a here thing, and hinging back, butt back, head forward. So the next modification we're going to be doing is tying shoes, which is a problem for a lot of my patients. So generally speaking, we sit down to do it. So we're here and we try to bend over. That hurts, okay? So the modification is actually instead tying your shoe standing up. So what you're doing here, you can keep your back nice and stable, lift your foot up, okay? Move your leg back, even sometimes if you want, even on a little bit of a higher surface, maybe a bed or something like that. So that way when you actually go to tie your shoe, you can bend more through the hip and less through the low back. So a modification for actually picking up something off of the floor. So when we think about that, a lot of times, you know, we say we want to bend through the hips and not through the low back, which is true, but it's just hard. So when you actually try to do this, I mean, this is something that usually will take me 2 or 3 treatments to teach. And so instead, I think this is an easier modification, which is just kicking one leg back to pick up an item. If you feel like you're a little off balance, then you can just use something for hand support. And then that way, you can see that when I do this, I'm not moving my low back, much safer, less aggravating.